What's the latest on antibiotic use and resistance? Are we winning this battle, or is it a losing one? The reality is, the war against antibiotic resistance is a constant one. It's a battlefield where we need to constantly reassess, reevaluate, and reinvent our strategies. One such strategy that has been making waves in the medical field is the concept of antibiotic time out. Antibiotic time out, or ATO as it's commonly known, is a pause, a deliberate interruption in the course of antibiotic therapy. But what does this pause entail? It's not a break for the antibiotic, rather it's a break for the healthcare provider, a moment to reassess the initial decision to prescribe antibiotics. The process of an antibiotic timeout typically occurs 48 to 72 hours after the initiation of antibiotic therapy. During this time, healthcare providers review the patient's clinical progress, diagnostic information, and culture results. This review helps in determining whether the initial choice of antibiotic therapy was appropriate, needs modifying, or should be stopped entirely. Antibiotic timeout is an integral part of antimicrobial stewardship programs. These programs aim to optimize the use of antibiotics to improve patient outcomes and, crucially, to minimize the development of antibiotic resistance. The concept of ATO encourages a culture of questioning, of not taking antibiotic prescription as a given. It promotes a thoughtful approach to antibiotic use, ensuring that every prescription is justified, necessary, and as effective as possible. The benefits of implementing an antibiotic timeout are significant. By regularly reassessing the need and type of antibiotic therapy, we can reduce unnecessary antibiotic use. This in turn can decrease the risk of side effects and antibiotic resistance. Furthermore, regular reassessment of antibiotic therapy can improve patient outcomes. If, during the timeout, it is determined that a patient's condition is not improving as expected, the healthcare provider has the opportunity to adjust the treatment plan. This might involve changing the antibiotic or identifying an alternative diagnosis. In essence, the antibiotic timeout is a tool for ensuring the judicious use of antibiotics. It's a strategy that promotes constant vigilance and thoughtfulness in antibiotic prescription. And in the fight against antibiotic resistance, these are powerful weapons indeed. In conclusion, the antibiotic timeout is not just a pause in treatment, it's a moment of critical thinking, a chance to reassess, and an opportunity to optimize care. In the ever-evolving battlefield of antibiotic resistance, it's an approach that could make all the difference. As the fight against antibiotic resistance continues, the concept of antibiotic timeout serves as a reminder that the war is not just about developing new antibiotics, but also about using the ones we have in the most effective and responsible way possible.